Hey everyone, welcome back to your fitness consult. I am Dr. Mary Ellen O'Brien, board certified physician in obesity medicine and internal medicine, who has been through my own fitness journey most of my adult life. So I'm doing this podcast so that we can talk about what I call all of the M's: macros, muscles, mindset, medicine, motivation, mental health, integrate everything, look at everyone from a 360 point of view through the eyes of a physician who also is interested in all of these topics. Today's episode, I wanted to talk about hunger during your period or leading up to your period during PMS, during perimenopause, and then finally menopause. And I think this is such an important topic because I know more and more information is coming out now, and I love seeing that. I love that society as a whole is being more educated. I love that women are being more educated about our own bodies. But this was not the case for a long time. I've been a physician for almost 20 years, about 18 years. And I can tell you that the stuff that's coming out now about perimenopause, menopause, hormone replacement was not anything that we learned when I was in med school or when I was in training. So I'm very happy that this is, a quote hot topic that everyone's talking about it. And so I would like to contribute to us, filling the space online with more information and to talk to women who are like me. I'm 44 years old. I'm just starting to go through perimenopause. Actually, I think I may have had my first hot flash today because I woke up and I felt fine. I have a hoodie I always put on all the time. And I came out to say hi to my wife, and all of a sudden I got this crazy urge that, I need to get this hoodie off, or I don't know, I'm sweating to death and I'm cold all the time. So it is starting for me. So I'm in the same boat as all of you perimenopausal ladies out there. So let's talk about hunger kind of in all the phases of a woman's reproductive life. So first, let's start with just some basic outline of the menstrual cycle. So it's broken down into basically two phases. There is the follicular phase and the luteal phase. You think about day one is when you get your menstrual period. And then that is the beginning of the follicular phase. That phase lasts 14 to 21 days. During that phase, your estrogen levels start to rise. And what this does is it helps the follicles in your ovaries to mature an egg. The follicles are a fluid-filled sac that has the egg and some supportive material, produces hormones to support that egg, and that would support a pregnancy if you were to have one. And so estrogen levels rise, that follicle starts to mature, ready to release an egg. The uterine lining starts to thicken. That's all happening during the follicular phase where the estrogen level is going up. During that phase, progesterone is pretty flat. Then you have ovulation, which usually, again, happens day 14 to 21. That's when the estrogen level is at its highest. Once ovulation happens, that's when your progesterone level finally starts to rise. And now we're in the luteal phase. So the luteal phase can last usually around 7-10 days or so. And that's kind of what we think about as PMS, or near the end of that is really PMS. And so that's when your progesterone level is starting to rise. Your estrogen does come down, and then it kind of goes up again, and it's kind of like that. It does rise again, but not as high as it was during the follicular phase. Progesterone really dominates during this phase, and then that will go up. And if you do not become pregnant, that progesterone level drops and estrogen drops, and then you get your period and you move on back to the beginning. So that's the basic cycle. And during PMS, all of us women out there, we definitely know that feeling. I mean, we know the irritability, the mood swings, the fatigue, all of that kind of stuff, but we know the hunger as well. I know personally for me, it's about at least one day, if not 2 days before I get my period, I have the hungry horrors. I just can't eat enough. Nothing will, satiate me. And so why do we get that? That's the rise in progesterone. Progesterone actually stimulates the appetite in and of itself. Estrogen serves a little bit to suppress the appetite, but progesterone dominates during that luteal phase. During that few days before our period, progesterone really dominates. So that is what causes our hunger, in that during that time period. And so, we want to talk about, well, what do you do? Because this is going to happen every month. So what do you do when you get that sensation? It's good to have a plan because, again, it's something that's going to happen regularly. And so there's a few strategies that are out there that you can use to try to help you with that. One is to plan for an extra amount of calories during those day or two, couple of days before you get your period, when you have the hungry horrors. And so, if you're in a calorie deficit of, say, about 300, even if you plan to have 100 to 150 more calories during that time, you're still in a calorie deficit. Even if you plan to go back up to maintenance and to have 300, those 300 calories back during that time, you're still in maintenance, so you're not gaining fat during that time. So it's really, listen to your body. It's really up to you. I would usually start, though, with about 100 to 150 of those calories back. Because, this is a difficult thing to do, a mind over matter concept. Like, this is a biological thing. Progesterone is really strong during that time, and it's really hard to fight her back. And so do not feel bad if you are giving into that. If you don't give into that, that's awesome. That's totally fine. And if you do give into that, that is also awesome and totally fine. A calorie deficit is a long-term game, and so this is something we have to be able to deal with, and that we have to be able to sustain for however long it takes to get to the goals that you want to get to. And so there's no need to put yourself down, to feel bad, to cause yourself, torture during this time. That, again, is very predictable. So have a plan in place. Try some things out to see what works. If you want to try 100 calories and this just isn't working for me, then you can definitely try more, the next month. This is really what works for you. And again, this is to say all the things we talked about in the first episode still apply to kind of satiate yourself against ghrelin in general. And so that would be to make sure you're having adequate amounts of fiber, which, again, for women is about 25 to 35 grams a day. While we're talking about fiber, I did want to bring this out. So what are some things that I use for fiber? Well, okay, you're going to laugh, but because my friends at work do, but I actually eat every day on my deficit. I have raw carrots, raw celery, I have cucumbers, and I actually have spinach right from the container. And I know that's a little crazy because I'm not cooking any of those vegetables, but I am lazy when it comes to making food. I'm not good at cooking food, and I like those. I never thought, by the way, I would be the type of person that would say, hey, I love that celery. That's good. I would roll my eyes at those people. So if you're rolling your eyes at me right now, I totally understand. But I did it long enough that, guess what? I learned to like it. So it definitely is possible. It's crunchy. I like the crunch. I like the texture. And you can eat so much of it for very little calories. And so those are some of the foods that I use to satiate myself during that time. And I can speak to that right now because I am probably in the hungry horrors period of my menstrual cycle right now. And I was jotting down some notes for this podcast right before this. And what was I doing? I had that bag of baby carrots out and I was munching on the baby carrots because it's good fiber, it's low calorie, healthy for me, it's a whole food. And so using that myself today to work myself through the hungers right before I'm getting my period. But in general, what are some other things that you can use? A lot of people use chia seeds like this. The thing with chia seeds, you can put this in a lot of stuff. You can put it in, if you have overnight oats, you can put it in smoothies, you can put it in yogurt, you can put it in anything, a protein shake. The issue with it, though, is in one serving, you do get 6 grams of protein, which is good, and you do get 10 grams of fiber, which is great, but you also get 7 grams of fat. So I don't use this that much. What I use is actually Fiber One cereal. This is my go-to if for whatever reason I didn't have enough fiber that day. If you do what I do and you eat all the raw vegetables during the day, you'll get enough fiber. I mean, spinach alone has a ton of fiber in it. But if I'm finding that I wasn't able to do that, I use that Fiber One cereal. The Fiber One cereal, one serving, it only has 1 gram of fat, but it has 18 grams of fiber in it. and 3 grams of protein. Sometimes what I do is I make a protein shake and then I put the fiber one in there and just have cereal in my protein shake. So I'm getting even extra protein that way. So those are two things that a lot of people use if you're not able to get your fiber in from your fruits and your vegetables. But really try to get it in from your fruits and vegetables. And we'll talk about fiber in general in a whole other episode. But that could be something that you really focus on right before you're about to get your period is your fiber. Make sure you're getting enough fiber. As we talked about last time, make sure you're getting enough protein and make sure you're spacing your protein throughout the day. Protein helps keep you full as well. There's no really hard and fast guidelines on how much protein to have at each meal, but the general recommendation is about at least 20 grams or so. That will keep you full and that will keep you on track to hit your protein goal for the day. Another thing we talked about last episode is hydration. So again, make sure that you are getting enough water throughout the day. Again, there's no hard and fast, accepted amount guidelines that you should have, but the general thought is probably between 80 to 100 ounces a day. But we all know you can be doing all of those things, and right before you're about to get your period, you just can't deal with things anymore. So what we usually recommend then, again, is to add those calories back or to have some more frequent meals throughout the day. And I tend to do that as well in general, but I'll even try to space that out even more so that I'm eating something maybe every 3 hours while I'm awake. And so again, that kind of helps to just settle things down for me. And so I may not be going over my calories for the day, but I'm spacing things out with smaller meals. Some other people use the strategy of eating a bigger meal to keep you fuller longer and make sure again that meal has a lot of protein, a lot of fiber in it, a lot of the complex carbs and not your simple sugars. So that is the hunger you experience and why you experience it during PMS. Let's now transition over to perimenopause. So perimenopause does have a definition. I know we kind of put a general age to it when we think about it, but the definition of perimenopause is actually a change in your cycle of at least 7 days. So if you get your period every 21 days, which for some reason my body's been doing for the last 5 years, 21 days passes by so quickly. But if you're getting it every 21 days and all of a sudden you're getting it every 28 days, or you're skipping and then you're getting it the next month, irregularities of at least greater than 7 days or greater, plus symptoms of perimenopause, then you meet the criteria. Now, we all know that your estrogen levels do start to decline as early as in your 30s. That's just a known thing. And so certainly by the time you get to your 40s, and again, I'm 44, I know that even though I may have had my first hot flash today, that I definitely have decreased estrogen compared to when I did 10 years ago when I was in my 30s. So even though I don't officially meet the criteria because I don't have that 7-day change in my period, I know that I'm starting to have the symptoms. I know that my estrogen level is lower than what it was. And so still pay attention to your body, because you should expect these changes to happen. And so what happens during perimenopause? Let's talk about that from a hormone standpoint. So I think we usually think about it as the estrogen levels just drop, but that's not the case. They are declining, but it's more of this, each day they can be higher than they are the day before, lower, they fluctuate. And certainly during your cycle, the levels fluctuate as well. Same thing with progesterone. Progesterone will decrease, but again, it's not a linear decrease. It's more of a wave and it's a kind of decline over time. So you do start feeling the symptoms from decreased estrogen and decreased progesterone. Estrogen is responsible for so many functions in the body, but in terms of what we're talking about today, in terms of hunger, estrogen actually will increase leptin. And as we talked about in our first episode, leptin is our hormone that tells us we are full. And so it works to decrease ghrelin, which says we're hungry, and increase leptin, which says that we are full. Progesterone, like I mentioned before, actually increases ghrelin, makes us hungry. And so progesterone and estrogen kind of are always working to balance each other out. And when you are in perimenopause, that balance is so out of whack. And so many women in perimenopause just experience the hungry horrors all the time. If you are going through, or women that are going through it, pretty noticeable that this is how women are feeling. And in general, we don't talk about any of these things as much as we should. Like as women, we should talk to each other about it. I know that we want to, be strong and just work through it because this is what we're all going to experience. But we should really talk to each other about it. It's not whining. It's not complaining. It's just being frank and honest and discussing with other women, like, this is what you should expect from your body. This is what I'm going through. Are you going through that too? There's some comfort in talking to your peers about what everyone is going through. And then you can learn from each other on strategies to help each other. So going back to the hormones. So estrogen is kind of declining. Progesterone is also declining. Testosterone also is declining. We don't, as women, have as high of testosterone, obviously, as men do, but our levels also decline, which in a future episode we'll talk about exactly, what the repercussions of that are. So in terms of ghrelin and leptin, those come back into play during perimenopause as to why we're hungry. As our estrogen levels start to decline. Another thing to keep in mind is that with the decline of estrogen and progesterone, you can have similar symptoms that you have during PMS, except again, perimenopausal women can have these symptoms so frequently, and that would be irritability, sleep disruption, anxiety, memory issues, kind of feeling fatigued and difficulty concentrating. Many of these issues that we see with declining estrogen and progesterone can lead to some of the other reasons why we feel hungry. So if you are having sleep disruption, and you're not sleeping well, we all know that in and of itself can increase ghrelin. And so that's just another way that declining levels of estrogen can contribute to our increased hunger. Another thing that happens during perimenopause is that our cortisol levels can rise. And as I mentioned in the first episode, talking about hunger in general, when cortisol levels rise, that can also lead to increased hunger, among other things. So again, sleep disruption, increased cortisol levels can also, in and of itself, lead to increased hunger. And then that finally brings us to menopause. So what is actually the definition of menopause? Menopause is when you haven't had your menstrual period for 12 months. And so when that happens, usually you're still in that hormone fluctuation with progesterone and estrogen being irregular, but they're much more on the lower ends of things. And it can take a couple of years even for those hormones to finally settle down. Once they settle down, your body kind of resets and your appetite kind of auto-regulates around that. And so in the postmenopausal state, that should all settle down and you don't feel all of those symptoms as much anymore, including that like intense hunger that you can feel when you're perimenopausal. But there are other changes that happen. Your metabolism for all of us starts to slow down around age 65. It's a very small amount though, so don't think that it is going to slow you down significantly. It's a very small amount, but it will start to decrease. As a result of that, your appetite can start to decrease. In general, people tend to slow down when they're around 65 or older. They don't have as much movement as they used to, and so your appetite can decrease. Postmenopausal women, though, can also have a change in their taste buds and their kind of smell sensitivity, all things that kind of make us want to eat. And so that can also cause a decreased appetite as well. And so generally speaking, postmenopausal women, for all of those reasons, don't have as much of an increased appetite. That is not a hard and fast rule. Some postmenopausal women still have a really good appetite, and so you would employ the same strategies. Okay, so we've reached the part of the podcast where we'll talk about our fitness consult question related to this topic. And so the question is, if I am perimenopausal and I'm having days where I'm having the hungry horrors all the time, what can I do? Because generally speaking, I don't want to have increased calories all the time. When we talk about going through PMS, we know that's going to happen once about every month or so. And so for those few days before you get your period, or when you first get your period and you're having those hungry horrors, you can still stay on track with what your goals are of calorie deficit, fat loss, or even maintenance, and add back calories. But if you're in a perimenopausal or postmenopausal state and you're having those sensations very frequently, you probably don't want to add back those calories all the time. Because if your goal is for fat loss, then it can start to add up and interfere with that goal. So what are the things that you can do? And so it is going to be very much of the same strategies. And so you need to have a plan in place. I can't stress that enough. We all know that when our hormones are acting up, it's really hard to have clear thinking when all of that's going on biologically. And so even me, we tend to not make great decisions sometimes as a result of that. So perimenopausal women, what can you do? Definitely strategies that have been shown to work for people are eating the smaller meals throughout the day. But again, make sure that they are high in protein. Make sure in general they're well balanced meals so that you have protein, you have certain complex carbs. You need to have some fat as well because fat is important for hormone production. But the big thing that you can do is hormone replacement therapy. I'm such a big proponent of that. That's something that, as I mentioned earlier in the podcast, that we were taught not to prescribe women as physicians because we were taught, well, it'll lead to increased cancers, increased breast cancer. But it turns out that is not the case. Hormone replacement therapy is something that I would recommend to all perimenopausal women because it will help. It's usually estrogen and progesterone together. If you still have a uterus, you do need the progesterone that will protect against uterine cancer. You can work with your provider on starting out at a dose, and you can increase that dose until your symptoms are improved. That will help so many of these symptoms that we've talked about, including helping with increase your leptin levels. But it will also help with regulating sleep. It will help with regulating your mood. It will help with many of those symptoms. It's not going to completely take away all of those symptoms. There's many more factors at play, including serotonin levels and all sorts of things. And there's so many studies coming out now about using different medical and other behavioral interventions to help with all the aspects of perimenopause. But in general, you will feel a lot better. You will feel more like yourself. And you probably will have a noticeable decrease in hunger as a result of being on hormone replacement therapy. If you go to the website, menopause.org, that will bring you to the Menopause Society, in which you can actually look up medical professionals who are sympathetic and compassionate towards women who are going through perimenopause. I know the current state right now is there are still so many doctors out there who do not want to prescribe these medications to women. And again, I've been a physician for a long time. I was taught not to do that as well. It wasn't until my wife was going through perimenopause a few years ago, probably right before the peak of COVID, in which she started having these symptoms. And I was very much against her even talking to anyone about that. She spoke to about 3 different doctors. None of them wanted to prescribe it to her, but she finally found a physician that understood what she was going through and understood that it is generally considered safe to be prescribed hormone replacement therapy. It's worth noting it's not for everyone, and so you have to talk to your provider about that to see if you're a candidate. But if you are, I recommend, taking it, using it, and that was also a great strategy for helping with your hunger. That's the episode. Thank you so much for watching. You can go to yourfitnessconsult.com. You can submit a question that you would like to be used on a future episode. You can reach out to me on Instagram, Dr. Mare. You can find me there. You can find me on YouTube at Your Fitness Consult Podcast, Patreon at Your Fitness Consult Podcast. On Patreon, I've already recorded a companion episode to this episode. And it's about the type of movement and activity you should be doing during perimenopause. So I highly recommend you take a look at that. And I'll see you next episode. Thank you for watching or listening to the podcast. This podcast is not meant to be medical advice. I'm a physician, but I'm not your physician. And this is not a binding physician-patient relationship. All of this is for informational purposes only. Please don't use this content to substitute for your own medical provider's advice. Please go talk to your medical providers about all the questions that you have, and please listen to their advice. If there's an urgent situation you find yourself in, please call 911, go to the nearest emergency department, and just know that medical knowledge always evolves. So while this may be current knowledge at the time, whenever you're listening or watching this, that knowledge may have evolved. Talk to you soon.